I think the footwear is really important because it starts with a nice review of the parts of a shoe. So it starts basic if we don't have that knowledge, and then it gets into the specific types of running shoes, and it talks about running economy and running performance. So you can understand how shoes are going to impact a runner. Some shoes make it easier, some shoes make it harder. When you're dealing with runners, especially if it's a runner who has, say, recidivism or recurrent issues, footwear has to be discussed because that could be a part of it.
Hi everybody, Dhinu Jayaseelan here, editor of the independent study courses for the Ortho Academy. We just had a talk with Dr. Paul Neal Czujko, and he is an independent study course advisory panel member and has actually taken a ton of courses himself as a participant. So what we talk about pretty briefly is the running athlete course and maybe what the independent study courses are as an overview for those that are not as much familiar with it, and what you would potentially get out of the running course. And so if you're potentially on the fence or maybe wanting to have a little bit more information about these independent study courses in general, I think this video is awesome for you. Hopefully you get something out of it, and please feel free to reach out with any questions that you may have. Thanks so much. All right, welcome everybody. My name is Dhinu Jayaseelan, editor of the independent study courses for the Ortho Academy. And today I'm joined by Dr. Paul Neal Czujko. Dr. Czujko, you've been on one of these interviews before, and so hopefully some people know who you are. But do you mind giving us just a brief intro of kind of what you're doing and where you're at right now?
Sure. As Dhinu said, Paul Neal Czujko, I teach right now at Stony Brook University, which is in New York on lovely Long Island, if anyone is familiar with New York. We are about an hour away from Manhattan and another hour and a half away from the famous Hamptons, which are not all they're cracked up to be. I teach mainly in our musculoskeletal track. So I handle kinesiology. We have a couple classes, and then I handle all the orthopedic classes as well, and spend some time in the anatomy lab, and then various and other administrative pieces.
And one of the reasons why we're chatting today, we're going to be talking about the running athlete, and maybe this might be relevant to some people that have that specific interest. I wanted to touch base with you specifically because people may or may not know this, but you have been a participant of most of these independent study courses and had a history of going through a lot of them. As an editor now, I actually wrote one of these monographs years ago, and then I became the associate editor before the editor. And as I'm going through the process, I'm learning about it. But a lot of people actually don't know maybe what these independent study courses are.
Okay.
So as a participant, but also as an advisory member of our panel for this this process, do you mind giving the listeners maybe what is the independent study course kind of from an overview perspective?
Certainly. So the independent studies, simply put, they're a series of monographs, and depending on what the topic is, they could be anywhere from 3 monographs to 6 monographs to 12 monographs, and all the monographs are under the same umbrella. So the one we're going to talk about now is running, and then every monograph in it obviously deals with running. So all the other ones, if you look at the titles, they're organized in a similar fashion, and basically what they do, the way I see them, is they're kind of a compendium. They take experts in the field. So when you look at who's written them, there are names that you'll recognize. There are names that you've seen at CSM or that you've seen in JOSPT, well-published or just well-known authors who are experts in that topic. And what they do is they put these monographs together, and they're super, super, super well organized. And that's why I'm such a fan of them and have been for the past 20 plus years, I think. They're just really well organized. They present the epidemiology of a condition, they present the differential diagnosis piece, they present the examination piece, and then the intervention piece. So it's a great thing to have on your shelf, whether you're in the clinic or you're teaching. I use them for both. If you're in the clinic and a patient comes in and they have a diagnosis and maybe you haven't treated it in a while, maybe it's the first time you're seeing it, these are great because you can pick them up and you can really quickly read through it because they're concise, but they're not like Reader Digest where they don't give you enough information. You can read through it and you can say, what's the best outcome measure I should use with this patient? What are some things I should be looking for in the examination? And then what are some interventions that I should be using that are evidence-based? So, and then from a teaching standpoint, again, if I'm putting together a topic, these are kind of the first places I go because it gives you a really nice framework, really nice organization. And then if I want to supplement it with additional literature that I can search for, I can obviously do that, but they're really well organized and they're super well referenced as well. So as you read through them, some of these, depending on the length, they may may have 100, 200, 300 references, and again, very evidence-based and very up-to-date. They all of them contain review questions to test you on the material, which is certainly helpful. And nowadays, most of them contain scenarios or cases. So it gives you that application of the material. So it's not just that didactic kind of knowledge presentation, but it takes you through how to apply it in the clinic. Or if a patient presented like this, what should be your differential diagnosis that you're considering? And they're all explained as well as to why the correct answer is correct and the incorrect answers are incorrect. And then depending on the individual monograph, some of them contain video supplements. So for some of the ones we might talk about today, there are video supplements for exercises or examples of exercises. Some of the ones in the past have examples of different special tests, different interventions that might be done. So they're just really well done. They contain just a wealth of information on a given topic, and they're just a great resource.
Yeah, thanks for that. Yeah, I pride myself on making sure that these are peer-reviewed, obviously, but that they're clinically relevant and they're tangible to the clinician. And I like that they're contemporary resources that are specific to the topic, and hopefully those topics are interesting enough and useful enough to the general population and specific patient populations. But I also don't want to necessarily put rose-colored glasses on these things. And there are drawbacks to these ISCs, and one of them for me is it's the written word. Largely, there are video supplements and there are discussions around it, but it is, as described, an independent study course. And so, what from your perspective, what are some potential drawbacks to these courses that maybe they don't fill the gap for you?
Sure. So I think exactly what you said. It's the written word, and whenever we talk about anything that's written, and those in education know this from textbooks, when something is written, it is up to date. By the time it gets published and it gets into your hands, maybe it's not so up to date. And it's why textbooks, every 5 years, they come out with new editions because they obviously want to keep them up to date. So it's the same thing here. There's a process. When these are written, they're very well referenced and very up to date. By the time you get it, or if you're getting it maybe a year or two after it's been published, maybe there's been some changing thought on a certain topic. So I think you have to be aware of that. So I don't think they're the be-all, end-all on a topic. I think they're a great starting point. If, like I said, if it's a diagnosis or a condition that you've never seen before, it gives you a really good background on it, and it gets you going in a clinical direction where, again, if you have to evaluate this patient later this afternoon or tomorrow, it gives you a really good framework as to how to set that up. And then it's up to you to do your due diligence to say, okay, let me see what might be current out there. Let me see if maybe some of these interventions are updated. So I think from that standpoint, like I said, they're not like these telephone book things, so they can be just a really good starting point. So they're not going to be all inclusive on a certain condition, because of that I don't know that that's the role. So I would say that those are probably some of the drawbacks, and I really don't see them as drawbacks, because when I get one of these, you kind of know that going in. Like if you think, again, this is the be all end all and it's going to give me everything about a topic, then that's just a misapprehension. I think, like I said, if you think it's a really good starting point, then I think that's kind of the way that you want to see them. I think they're great for students as well. You have a student in the clinic and they haven't seen a condition, you can kind of give them this, let them take them home in one night. They can kind of read through it and come back the next day, and they can kind of tell you, this is what we should be looking at on this evaluation. This is how we should structure it. These are some prospective interventions that we should be thinking about. And then, in the same breath there, if it gets the student aware of the academy and gets them to the website and interested in some of what we have to offer, obviously I don't think that's a bad thing. So yeah, I'll kind of consider those as drawbacks.
Yeah. I mean, it's a supplemental resource to clinical practice and additional resources for sure. To your point, yeah, some of these do maybe lose some of their contemporary relevance after new research gets published. There are certain courses that we definitely want to update. Post-surgical management is one that we're updating. The current concepts, we update those every few years.
Save the date for the 2024 AAOMPT Conference, October 23rd to the 27th in Orlando, Florida. Join OMPT professionals for 5 days of continuing education focused on OMPT, hands-on learning, research, networking, and more. Visit AAOMPT.org for more information.
Running Gait, though, that's a thing that everyone probably needs to know about. And I'll, as an educator, also as a clinician, it's tough to get good at evaluating and treating abnormal running gait, especially for that person that's got symptoms. And our students have a hard time with walking gait to begin with, and then adding in speed to it can be difficult. So when you read through this ISC as an educator, as a clinician, what are some of the high points? What are some of the main things you think about when it comes to like takeaways that you learned about from a running gait perspective?
I think the great thing with it is, again, the organization, like I said. So there are 6 monographs in this one. And, the first one talks about just the science and the rehab of common running injuries. So it's a really good differential diagnosis piece. It gives you the most common lower extremity running injuries that you're going to see if you're treating a population of runners, tells you how they present, tells you the best interventions for them. So I think that's really a good takeaway. There's a monograph on footwear, which if you're dealing with a runner, you need to at least have some cursory knowledge of footwear, because they're going to ask you about it. And it'll talk about the different types of shoes. So traditional shoes, minimal shoes, trail shoes, spikes, all that kind of stuff. So that really is useful, because again, if it's something that you're not aware of, and you don't have much knowledge on, in a real quick read, you can have at least a decent appreciation of it, so that you can have an informed discussion with your patient or your client as to, if they're asking you about these like shoe wear or anything like that. They talk about different levels. There's a monograph on different levels of runners. So they talk about novice, recreational, competitive runners. So if you happen to be treating a runner that just likes to run 3-4 times a week because they enjoy it, that's very different than someone who just started running yesterday, versus someone who is a high school athlete or a college athlete on a scholarship, looking to get a scholarship, and they're really competitive, and every second matters. We have the Olympics coming up in a couple of weeks. They're obviously very competitive runners. There's a monograph on adolescence, which I think I always start every course I start talking about differential diagnosis, and then I go into specific conditions that are specific to adolescents, because they present a little differently and they need to be managed differently. Obviously, these are still skeletal structures that are still growing. So that monograph is done very well. It kind of takes us through that. And then there's one on running biomechanics and energetics. So it talks about the kinematics and the kinetics of running. So a nice, real, great summary of that. If we're not familiar with that, because the mechanics of running are obviously a little different than walking. And I think with anything, the more you do it, the better you get at it. So if you're treating runners on a day in, day out basis, obviously this stuff is going to be second nature to you. If you're not treating runners, again, it's a great reference, so that you can speak a little more knowledgeably about it and understand what's going on with them, and specific issues that they may present with, and specific interventions that may work for them. So, again, I look at it and it's organized so well, and it really does speak to the clinic. Sometimes I think you read a research article and you kind of read through it and you're kind of like, but how does this apply to a patient that I'm going to treat? And you don't have to do that with these. You read these, and again, if you have a patient sitting in front of you, you can say, I just read this. This is what I'm going to go do for this patient, or this is what I'm going to examine. So, I see this is a great reference for, it doesn't make a difference what level you're at. If you're I am a runner myself. I did my PhD work on minimal shoes. So I have some knowledge in this area. You still glean things from this. You still pick things up, or there's still things that you've forgotten. So even if you're a runner yourself and you're treating runners, there is still information in this monograph that will be very useful to you. And then at the other extreme, if you've never treated a runner before, this is also perfect, because it's not going to be over your head. It's not written at a level that you have to have some previous experience. You can read it, you can understand it, and you can clinically apply it right away.
And I like that this was created with so many levels, because a lot of times it's not just students. I don't want to put it on students, because obviously we're not expecting them to know as much, but when we talk about the difference between running gait and walking gait, obviously we go faster, and maybe there's a different phasic progression to it.
Correct.
But running gait is not as easy as just saying you're moving faster. There's so many variations and levels and differences within the people that are doing it, and the surfaces that they're doing it on. And so this ISC, I think, does a great job of breaking those things down and making it clinically relevant. And you're right. I think when we talk about research, there's so much research around running, and that's high level, very specific, granular type of kinetic kind of research
Correct.
on running. And sometimes I wonder, like, how is this relevant to me, or when my patients are moving, what does this actually mean when they have knee pain compared to they don't, And so being able to make this clinically relevant is important. If you had to say like some big picture things that you took away that are being used in your practice, obviously
Mhm.
you've got a different background than
Correct.
the average clinician when
Correct.
it comes to your own research. What are some key points you think that participants might get from this that they might not be able to get somewhere else?
Okay. I think the footwear is really important because it starts with a nice review of the parts of a shoe. So it starts basic if we don't have that knowledge, and then it gets into the specific types of running shoes, and it talks about running economy and running performance. So you can understand how shoes are going to impact a runner. Some shoes make it easier, some shoes make it harder, those kind of things. So the footwear one was really great for me because it really did a nice job of summing that up. And again, when you're dealing with runners, especially if it's a runner who has, say, recidivism or recurrent issues, footwear has to be discussed because that could be a part of it. So that one I think is done really, really well. I think the information, just the way it's stratified across a few of these monographs, where I alluded to it, I said it before: novice, recreational, competitive, and then we have the one on adolescent runners. So it lets you stratify it so that you can really be specific to the patient that's sitting in front of you. What level are they at? What age are they at? And you can really hone in to specifically what their problem is and not just treat every runner like they're a runner because, again, there's a continuum. So I think those are probably the two biggest things I took away from this. That, like I said, the footwear piece is really great. And then just when you read all of them, it really gives you a nice picture of treating the running athlete or the runner, whether they're 12 or 13 or whether they're 62 or 72 or beyond.
Mm-hmm. Yeah, and the intent, I mean, there is an intent on systematically kind of presenting the literature that's
Sure.
available. But one of our goals with this is, and we ask our authors to specifically add in their opinion and their clinical expertise, so we can have that from them. Um, are there some items in these ISCs that maybe came as a surprise to you, given your background as a runner and somebody that's done research in running? Something that maybe wasn't expected?
Um, yeah, I think in the adolescent one, they did a really nice job of just talking about the phases of growth. And then they did a really nice job of presenting the risk factors, both extrinsic and intrinsic. And when you read through that, I don't think there's ever been a monograph I picked up, no matter how many years I was in practice, where I didn't pick something up where you read it and you said, ooh, I forgot about that, or I didn't know that, because they do such a really, really nice job of it. So, yeah, I would say that was probably the biggest thing. That adolescent one I thought was done really, really well because, again, talking about the different phases of growth and how the tissues respond and don't respond. I thought that was really well. The one on injury prevention had a really nice discussion on discharge criteria, and I think that's something that I know certainly when I graduated in '95 we struggled with because there weren't a lot of discharge criteria or like return to sport criteria. It was just kind of like, well, I've been treating the person for 6, 7 visits. They say they're doing better. Why don't you try running and see what happens? That's kind of where we were. And these present more evidence-based examination techniques or outcome measures you can use, so you can confidently say, I think we are ready to return you to running if the person hasn't been running. And then they present a real nice way to return someone to running. So it's not just go out and run 5 miles today, but it's, here's a walking program you start with. Here's how you phase back into running. So that's something that is just kind of inherent to me when I talk to runners. But when I see it in a monograph printed out like that, I just realize that, yeah, that's not automatic to everyone. And that's a really, really nice job. And it's obviously really, really important because, I have a cartoon that I kind of use, and it says, I'll just wait till the pain goes away to stop running, said no runner ever. Like, no one wants to stop running. I've been there, let me stick a heel lift in there and maybe that'll make it feel better. So that return to sport piece is really, really important because the first question a runner is going to ask when they come in for treatment is, how soon can I get back to running? if they haven't been able to run. So it's nice to have some objective data that you can use and you can apply, and you can have that discussion with them and say, I want to do these tests or these findings, and then based on that, I'll have a better idea. And then you can, with some confidence, tell them, let's see where we are in a week, or let's have you go out and do this today. And then based on your response, we can progress it and go from there. So I think it was just really nice to see that presented really cleanly.
Yeah. It's an interesting point, because I don't run personally. I mean, I know how to, but I don't like to. But I treat a lot of people that do. And I've never met one runner that says, yeah, I'm okay with just taking the next couple of weeks off to get better. This is a population that's very unique.
It's not in the DNA.
Yeah, this is a very unique population, and you have to deal with some psychosocial variables that are very different than maybe some other populations. And
correct.
Runners love what they do, and they don't want to stop doing what they're doing. And
correct.
I like this because it gives you so much information on how to keep them doing what they're doing.
Correct.
Safely.
And that does come up in one of these monographs. They talk about the biopsychosocial piece, and they give you alternatives to running. So if you have to suggest to someone, I don't think we should run for a week or so, it's not just like you're telling them to go cold turkey. It's how about trying swimming, or how about trying biking, or something like that. So that's also a really nice inclusive piece, because again, it's going to come up.
Yeah. And it goes from the understanding the research that's available, how to manage this person, how to progress them from beginning to end and keep them well. And so I'm very happy with the product. I'll say that I can't take credit for it because this wasn't under my editorship.
As a dedicated orthopedic physical therapist, you understand the importance of staying current with the latest techniques to better serve your patients. With Gait Analysis Continuing Education and Technology, RunDNA is committed to accelerating your expertise so you can help runners achieve their best. Visit rundna.com/AOPT to learn more and get your free ebook, Top 5 Things Running Professionals Need to Know.
What were some maybe parting shots you would have for the person that's on the fence? They see runners all the time, but they're trying to look for options to enhance their professional development within this population. What are some maybe guiding points you would give to that person on whether or not they should maybe go this route with the ISC or maybe something else?
Yeah, so I mean, obviously, a lot of factors come into play. I mean, if you can stand to take a 3-day course, if you have the money, if you can travel, those are wonderful. I've done those as well, and those are wonderful. I don't need to mention specific ones, but those are great. This is awesome because, again, it's take home. If you want electronically, you get it electronically. I like the paper version, so I always have them send me the book, and I can highlight and everything like that. But like I said, it's great because you can keep it on the shelf, and it contains everything that you need to kind of get going. And then if you have more questions, it gives you a great starting point. You can kind of research it and go from there. So I think it's great. I think another piece that can't be ignored is that you can get CEUs from this. They give you review questions, so you can run through the review questions, and then you can get CEUs by completing the examination for this. So if you're, I think every state has some form of CEU requirement for renewal, and it can be hard to travel to get to a course and more expensive. And this is great because you can sit at home and you can get CEUs from it that are acceptable, I think, to most states. So I think that's a piece that I never really cared about, to tell the truth, but I just wanted the information. But I think for those that might be, again, struggling to find CEUs or not being in a position where they can travel or spend money like that, these are great because they give you a lot of bang for your buck. They really, really do. You won't be disappointed. There's a lot of information in there, and more information than you think.
Yeah. And I appreciate your perspective on this because obviously you've taken a number of courses and seen different quality courses potentially in different topics. But also, I really do appreciate you coming on this and talking about it because, as you know, we always meet annually to talk about what's the most relevant to the readership, what's the most relevant to the academy, how can we benefit them, and what can we do to make a solid product that's going to be useful. And this is one of those products, I think, the running course. Absolutely. And I'm hopeful that people that are interested in the topic can get something out of this course. But I'm also hopeful, after going through this discussion, people will know more a little bit about the ISCs in general. And also,
Absolutely.
I'm hopeful that people can reach out to you and I about anything that have questions about when it comes
Absolutely.
to new ISCs, or how do we develop things that are more clinically tangible. And I think that's our purpose with this ISC process. And so I appreciate you talking about this process as a participant, panel member, longtime reader, and somebody that uses them in clinic and in school.
Absolutely. I mean, and we're always looking for ideas. So again, like you said, if anyone has a great idea, if they want to reach out, we're more than happy to discuss it and investigate it.
Yeah, absolutely. And so, yeah, thanks again for chatting. Obviously, this is a little bit of a brief chat, just giving an overview of the
Yep.
process in this running gait.
My pleasure.
But I appreciate your time, and hopefully we can do this again.
Absolutely. Look forward to it.
All right. Thanks so much.